So this is the fourth in a 5-part series that Elderly Affairs has sponsored. We had a really very interesting 3 other topics prior to, and these are recorded on my, they're on the website, my website, kūpuna so you can watch them. But we went through different topics about how to determine a good fit with a caregiver or a care setting, what questions to ask potential caregivers, which is really eye-opening for some people. And then the third one about deciding, what is important to you or to your loved one when you're looking for care. Today's topic is also really people have a lot of interest in it to know exactly what's out there. And then I'll talk more about the last one later in the presentation. I always like to start with 2 quotes that have kind of guided me through the years in this whole process. Over 10 years ago now, the Hawaii Long-Term Care Commission was formed and came out with a study. And this is a very powerful thing in my mind that guides me. Unless people have basic information about long-term care, the costs, all of these things, they're unlikely to be motivated to create plans. And it's not your fault if you've been very interested or need the information. It's really hard to find. And that's the next quote that the Hawaii Community Foundation had a study a year later stating that the stress of navigating this system that we have is very difficult. The stress is high because it's difficult to find coordinated information. What does it cost? Who's out there? What are the differences between types of care? And so that's been my sort of North Star over the years as I try to help families through this educational process. For those of you who have been to my seminars, you already know that I like to do these little quizzes. So the first, or my only quiz for this morning is this question: what does ADL mean? The term is going to come up quite a bit, so it's important to know. Is it A, alcohol, diabetes, and liver failure? B, activities of daily living? C, Alzheimer's depressive lifestyle? D, autoimmune disease lab work? E, aerate, drain, ligate, like, for wound care? Or F, none of the above? So who thinks it's A? Who thinks it's B? Who thinks it's C? D? E? No, F. Okay. So many of you maybe have already heard this term before. It is activities of daily living. The other ones I just made up. If you Google it, something will be, it won't show up. But activities of daily living is a very important term. And anybody know what those are? You want to just shout out? What are some activities of daily living? Anyone? Eating, I heard. Sleeping, transferring. Socializing is kind of one, yeah. I heard maybe like bathing, all the things that you and I do on a day-to-day basis, and for most of us, we can do independently. There's also something called IADLs, which is instrumental activities of daily living, and that is going to be something more like socializing, managing your bank account, paying your taxes, talking to somebody on the phone. Those are other types of activities that you and I can do without needing assistance, I can see. And so when we age and when we start talking about elderly care, activities of daily living comes up because it affects maybe insurance coverage. A lot of times insurance companies will say, well, how many activities of daily living or ADLs can you do by yourself? It will affect all sorts of other sort of nursing assessments and things that people, it will determine, what type of care may be more or less appropriate to them. So great job. You all aced my quiz. And we'll move on. We have a very heavy topic or chunky topic today. There's a lot of information to go through. But today's seminar is really introducing the main types of licensed care services. Now, there's a lot of other sort of unlicensed things that you could do to accommodate somebody's care needs. You could hire somebody and pay them cash under the table. You could have a neighbor kind of taking care of your loved one. But today we're really going to talk about licensed options. And these are the main types out there. They're sort of color-coded. And as we go through the seminar, you'll see that your handout has the most crucial information about what I'm presenting. So don't feel like you need to write notes on that. And we're just going to kind of jump right into it. So the first type of care that we're going to talk about is adult daycare. Now, this is a program that's usually in some sort of facility or church, like Central Union has an adult daycare. And the main goal, which is what I'll be reading from these slides is up on the top in red, the main goal is to really socialize and have recreation with other people. I had my carpenter had a fun little thing. He would take his mom to daycare and he would say, "Mom, okay, it's time to go to school." Because that's kind of what it's like. You go there every day and you have activities and there's a lot of fun and games. It's almost like a senior playground, and they provide lunch. And at the end of the day, the participants go home. And so it's really great for somebody who is looking for that socialization, who wants to be able to connect with other seniors. Maybe they're at home or living with family, and during the day, they would otherwise just be watching TV or something. Adult daycare programs are really fantastic for that. The key is that the participants need relatively minimal assistance. They don't have a lot of caregivers there to help hands-on or to do any sort of toileting even. Maybe some do. And it's a really, really nice way to give a break to the family members who may be taking care of their loved ones at home. It's also a really nice value, and we'll talk about cost later on, but the value of adult daycare is much higher than if you were to move into a care facility for day services. Now, the downsides, like I mentioned, it's not really appropriate for somebody who needs a lot of hands-on help because they just don't really have the caregivers there to help the participants to walk or ambulate. Some daycare programs are open to you bringing your caregiver with you. And so then you can participate in the activities, but then for my care needs that I might be getting addressed, it would be my private caregiver. That's not as common, but I have heard of that. It's also because it's so kind of lively and engaging, and there's a lot of singing, people do activities, maybe there's new faces. For someone who is living with dementia or Alzheimer's disease or a related dementia, it can be very overwhelming. Many people who live with dementia, maybe when they see different faces, they get kind of confused, or they have a hard time adjusting to even just a lot of sounds. So if your loved one or if you are living with dementia, then there's smaller daycare programs, like maybe 5 or 10 participants, that might be more appropriate than, say, at Central Union. I think Central Union has like 60 participants. And so that might be a little overwhelming. It's like if you were to think, okay, what would be, do I need to send my kid to like a university or like a small college? The fit is a big thing. And I've talked about this in other seminars. Some of you have been to them. The size of that setting is really important. They provide meals, they provide activities and stimulation. For added fee, they can also give you some meds and do some other services. But for the most part, or like showers, some people opt to get their loved one showered before they come home. Some also provide dinner as well. So it's a really great program because families get a break. I mean, it's if you're taking care of your loved one at home, you can actually now go to work, or you can just have quiet at the home, right? I'm a huge advocate and fan of adult daycare programs. So next type of care is home care. Now, this would be somebody that goes to your home to provide care to you or to your loved one there in that space, right? It's a pretty straightforward concept. It's really great for somebody who has a home, of course, that's important. It's also great for people who that home environment is safe enough, is comfortable. They love the flexibility or the familiarity of being at home. My grandmother lived in this house up in Aleva Heights for like I don't know, 60 years or something like that. She knew that house like the back of her hand. Like she could walk with her eyes closed probably and know where everything was. So she really, really wanted to stay at home. And for people who have a home and it's safe enough, then that's home care is a nice arrangement because it's comfortable. We're familiar with it. But it has to be safe. And the downsides to home care is that when somebody needs care 24/7 or even more than, let's say, 6 hours a day, it gets really, really costly. We'll talk about prices later, but home care is not that great when it comes to 24/7. Now, if I have the funding to pay for it and I want to continue to pay for it, then that's great. But it can be really expensive to be cared for at home day and night. The other issue is that there's some other risks involved, and those risks are like boredom. If I'm living at home and I don't really want this caregiver in my home, but my daughter says, "Dad, you need somebody to watch you during the day," then that can kind of set up a little bit of friction, right? Maybe some of the risks too is that depending on if it's an agency that I've hired or even just under the table, sometimes one of the biggest complaints about home care is that I have a different caregiver that shows up every day, and that is a challenge, especially in our labor market these days. A lot of home care agencies, unless somebody is paying for like 8 hours a day of home care, then the agencies aren't able to give the same caregiver every time. And so if my dad lives with dementia and then he has a new caregiver every couple of days, then he may get confused or really agitated about why is this stranger in my house right now? Yeah. So there's risks of caregivers being kind of inconsistent. There's risk of decline. I don't know if I'm married with 2 children. I love going on vacation with my wife. It's really pleasant. But if I'm with my wife every day for, let's say, 8 hours a day, in the living room and then in the bedroom or wherever, and it's or maybe more than that, we maybe stop talking, or we kind of maybe even get a little snippy with each other, right? We need fresh air. And so if your loved one is at home and they have this one caregiver just sitting with them, and the caregiver is there to provide care, maybe they're not really there to do fun games or activities. Maybe they're there to help, try to convince mom to actually walk, but mom doesn't want to walk right now. She just wants to stay in the couch and watch TV. So some of the real big risks of home care is this decline that happens even though there's a caregiver there. Boredom sets in. I mean, it's very difficult to convince somebody to do something they don't want to do. And so that's one of the challenges that happens for people living with home care. The lack of stimulation can be a real issue. But home care is very flexible. You could basically pay these agencies for the caregiver to do all kinds of stuff. Sometimes they'll, besides the activities of daily living assistance, they can maybe prepare meals for you. They can do housekeeping, like laundry and stuff. A little bit of cleaning at times. And then, the actual stimulation and kind of exercise, those are services that are all kind of included. Now, if you needed them to provide medications or to provide transportation or even outings, some agencies will charge extra for that. Others, they'll say this is just included. It's different from something called home health. And home health is when the doctor, maybe your loved one has to go to the hospital and gets discharged, and instead of going to like a rehab facility, they can go home. And home health is a very, very similar service, but the payment comes from health insurance or from Medicare or something like that. And so home health is a very short-term thing, but it's a little bit of relief in terms of the cost because it's covered by health insurance. Okay, I know that this is, I already see some faces being like, whoo, this is a lot of info. We got 7 more of these. Okay, independent living. Now, has anyone ever heard of the Plaza? Yeah, right. There's Kalakaua Gardens. There's Ilima at Lehano over in Kapolei. There's Hawaii Kai. Well, now Hawaii Kai Senior Living is called Ivy. independent living facilities are oftentimes these large campuses of buildings, but there's also smaller ones, and it's kind of like a retirement community. There's a wide range where the big ones that I mentioned, they provide meals, they have outings, they have nice, group activities. Other independent living facilities or services are much smaller scale. Like, over in Manoa, where I have my care home, we have one by the park, and it's kind of more like senior housing, retirement. Maybe they gather some services together for meals, but there's quite a few independent living facilities. The key thing is that for people who live there, they have to be kind of independent, right? Like, there's no caregivers there to provide a lot of hands-on services. The idea is more about group living, about kind of not having to do as many chores, about socializing with other seniors. And often, there's even some independent living facilities that are subsidized or very low cost for people on fixed income. So independent living is a really great environment for somebody who needs, they would otherwise be living alone. And you may or may not have heard that loneliness is one of the biggest killers for our kupuna. And so living together in sort of a retirement community, be it one of these big places like the plaza or a small place where they're just sort of in a group living situation, can be very, very helpful for individuals, especially if maybe their family are in the mainland or something like that. The downsides are like what I mentioned. They're not providing any care hands-on. Like if I need it for my ADLs, if I need help transferring out of the chair or showering, I could hire the home care agency to come to my independent living situation, but that's an added cost, right? So it's sort of a challenge to have care needs in an independent living facility. Some places, like the big ones, might feel a little bit like a revolving door of people that come and go. There's the plaza or those types, they're a month-to-month payment. And so some people may stay for like 3 months or 6 months, and then something happens, they got to move out. And what just happened? I mean, I spent all this time making friends with them in the dining room, and now they're gone, right? So it may feel a little bit like a revolving door. The other issue, which I didn't write on here, is that sometimes there's no openings, especially for the senior housing type ones where they're subsidized. Like, there's a high demand for it. And so sometimes the openings are kind of, you have a long wait list. It's also different from what's called assisted living. And that's a term that we normally hear about. But at least in independent living, there's somebody there in case of an emergency. Like if I fall, there's oftentimes some kind of manager on site, and they can at least call 911 or the other people that live there. Maybe they have meals, maybe they have outings, like again, if you're in the plaza type ones. And then added fees, like some of those places, Hawaii Kai Assisted Living or Kalakaua Gardens, once I do need care, sometimes they have like another kind of group or agency there, or even their caregivers can start to come to my unit, my apartment, and provide services to me, but that's an added fee. So what happens if I need more assistance? What happens if I'm at the plaza and I'm beginning to have issues walking, or I need somebody to help me shower? At some point, that might cross into something called assisted living. And this is a term I'm sure you've heard of. It's a term that on the mainland, and for like insurance companies and whatnot, like assisted living is kind of the go-to term for these large communities where you have seniors living. And it's kind of, the idea in my mind is one of these big campuses or buildings where you have like 120 people living in it. Assisted living and independent living sometimes are in the same building. Sometimes they're in the same campus. Like Hawaii Kai Assisted Living has assisted side, and then they have independent side. Like the title, it's like a little bit of assistance. So you can get that care when you need it. It may not be constant assistance, but they have caregivers who can come and perhaps, take me to the bathroom, or help me with showers, these kind of high risk activities. So again, like independent living, it's really great for the socializing aspect. It's really great for outings, or like I don't have to do my meals or anything like that. A lot of times these places will charge extra for laundry, but like those kind of household chores, the housekeeping, like I don't have to worry about in assisted living. Um, it's really a for the right kind of person or personality, it's a great environment because it feels really social. Other people complain that it's like too big. They feel like they're living in a hotel, and they don't like that, right? And for especially for people who are living with dementia or have Alzheimer's or something, being in a big space like that can get kind of a little overwhelming. So there are downsides. Other downsides that happen in that large setting, or let me see what I said here. It can be really costly, again, if you need that round-the-clock care. Because independent living, assisted living, maybe they have somebody to help me, walk or take a shower, but it's not going to be round the clock. And if I need that round-the-clock care, a lot of times they'll say, okay, well, you can bring in one of our caregivers, or you can hire the home care agency to have somebody in your apartment. And then that's going to be added cost on top of the monthly cost that they have there. Another issue with independent living and assisted living is independent living facilities are not licensed by anybody. They're kind of listed, but the Department of Health doesn't actually provide some license to the independent living facility. Assisted living is a licensed service. And so when you have these two groups of people, the Department of Health doesn't like the idea of them mixing, because they don't know, it's like all these independent people, maybe they're actually living in the assisted, but we're not tracking them. And so in some places, like in Hawaii Kai assisted living, there's different floors, or there's different buildings even, where the independent and the assisted side are separated. Pohainani, I think, is like that over in Kaneohe. And so if I'm living independent living and I got all my friends, we play mahjong every Thursday and we like to hang out, suddenly if I have to go to assisted living, then they're not going to allow me to hang out with my mahjong crew, and I got to make a whole new one, and they got to learn my mahjong rules and all that stuff. It's a mess. But because you need that separation, because one is licensed, one is not, then a lot of complaints would be like, I got to move to the other wing or a different floor, and they may even be different dining rooms and that kind of thing. Now, some facilities have gotten around this by just saying, okay, everybody's going to be assisted. And even if they're in the assisted living, then they could still be independent. That kind of gets around it. So Ilima at Lehano in Kapolei is like that. Everybody there is technically living in assisted living, but they could be independent. So, and I think we'll start to see that more for these big facilities. But it's one of the things, I've had residents at my care home who say, gosh, once my husband moved to the assisted side, he kind of declined because all his friends were not there. Some of the other issues for assisted living is that you got to kind of keep up. It's a big environment where you have a lot of seniors, and I have some presentations later that I'm going to do about this. Hanging out with the cool kupuna, because I'll give you an anecdote. There was a gentleman at my care home who was suffering from Parkinson's, kind of a later stage Parkinson's. And he was really slow to move around, had swallowing issues. But in my care home, because it was small, he was like the top dog, compared to some of my other residents. And so everyone said, oh, my caregivers would say, Papa, you're so great, and all this stuff. Now, his wife was living at home, but she had an accident. And so the kids said, Dad, I'm sorry, you got to move out of the home so that we can bring mom in and she can get more care. They thought, okay, great. We'll move mom in, and then dad moved to an assisted living facility. When that happened, it was like too big for him, and mostly too big because everybody was pretty independent in the assisted living facility. They could still do things on their own. And so what happened is he was the big fish in the small bowl at my home, but then he was like beyond the reef in this other big facility, and it was very lonely. And in fact, his son would complain, it's like, I think these other seniors are like excluding my dad. They don't want to sit with him at the dining table. They don't want to talk to him because he's slow. And so the size of these places really makes a difference for the ability that the person has. And I talked about that in some previous seminars, but that's one of the things about independent assisted living facilities is that it's important to make sure it's a good fit. Okay, whew, that was a lot, right? Okay, we're gonna, oh, what's going on here? Dad came back to my care home. Yeah, he came back because once I had another opening, he came back. The kids said, oh, that was terrible for him. And because in assisted living, they don't have a lot of caregivers there, the facility was telling the family, your dad he takes like 2 hours to eat his meals, and our staff can't really help him. So it just wasn't a good fit. Dad needed a care home, which is what we're going to talk about right now. Actually, I don't know, my little clicker is not working. Shucks. So Dad, yeah, that was really sad, but it worked out, in the end. Okay, so now we're going to talk about care homes. And oh, shucks, wait, no, technical difficulties there. Okay, so Dad was previously at a care home, an adult residential care home. This is like a home, like like your neighborhood house. And the goal or the key thing about it is that it provides care round the clock, 24/7. Now, I take that back. It could be supervision. At least the caregiver is there 24/7 to be able to help the residents. It's a much smaller environment. It's like generally there's 5 beds to the home. And that 24/7 is just kind of baked into it. Whereas in independent living, assisted living, I'm not there to be receiving that round-the-clock care. In a care home, it's smaller, it's more residential, and it's meant to help me round the clock. Now, some care homes may have caregivers awake overnight. Others, they can be sleeping, and that's okay based on the rules. But the main thing is, Dad can go there, and at least I know somebody's going to help him at night so that I don't have to wake up and take him to the toilet and that kind of thing, right? It's really great for somebody who needs, at least supervision, but maybe intermittent or even total care round the clock, day and night. It's great for people who feel like the assisted facility is just too big. It's like, I don't want to live with 119 other seniors. I'm overwhelmed by that, or I don't like this large place. And so the adult residential care home is a smaller environment, much more intimate. The downsides is, I'm sure you've probably read articles in the news where it's like, oh, I heard that care home over there did this to their residents, and then all kinds of bruises and all this, right? We hear horror stories about this, and much of it has to do with the fact that there's just so many. I mean, we'll talk about quantity, but there's so many care homes, and they're very small. They're usually kind of mom and pop operations. So these facilities get a really bad rap. It's hard to tell like which are the good ones, which are the bad ones. There's so many of them, and so either the quality of the care or like how we perceive that quality can be varied depending on care home to care home. That's one of the big complaints I always hear about it, and I understand completely what that where that comes from. Sometimes too, when there's actual availability, it might not be in the location you're looking for. There's a lot more care homes as you go more to the west than there are in town or even in East Oahu. So the location might not be that convenient, but it is a really hands-on service. Residents can stay there through end of life, and they have a lot of course, all the meals, the housekeeping, the laundry, all of that is taken care of in a care home. What's not included is maybe a higher level of care, like if I need nursing services, or if I need somebody to prevent me from walking out of the care home and going to the mall and not being disoriented. A lot of times care homes may charge extra for that if they still allow that resident to stay. Transportation, some homes may charge for that, others, it's included. So there's a little bit of variation between them. But generally, when you hear care home, that's one of these facilities. There's another type of residential home, which we'll talk about right now, which is an adult foster care home, or the technical term is a community care foster family home, CCFH, but most people call them foster homes. And this is also very much like an adult residential care home. It's in a neighborhood. There's going to be a small environment. They can't be more than 3 residents. The key benefit to this, the key value proposition to foster care homes is that they're meant to be providing kind of higher level nursing care. And oftentimes, they are required to have residents who rely on Medicaid. Now, Medicare, anyone familiar? You're probably all familiar with Medicare, which is for medical services, but Medicaid is like a financial assistance for people with low assets. And so in a foster care home of 3 residents, sometimes they have 1, sometimes they have 2, but of 3 residents, 2 of those residents have to be covered by Medicaid, which is a really great thing because care is expensive. And so having 2 of those residents being covered by Medicaid, it means that the third one may be private pay. It may be that they're also Medicaid, but at least there's an option for people who need that nursing service. I'm going to get a little bit more in depth about that later. But one of the downsides to this is, well, some people may think of it as a downside. Some people may say, this is actually kind of nice. You're living with a family in a foster care home. So the caregiver has, their home, and then they have a room or maybe 3 rooms, and then the residents will stay there with the family. And so you're kind of part of a family. That could be nice. That could not be nice, depending on, the senior. Do I want to live with my family, like my siblings later in life? I don't know. Anyway, I'm thinking about this, but I don't. Well, yeah. Anyway, so you're living with a family, and one of the really key things about that size is it can feel a little bit more informal, very casual. Sometimes people complain that it's like too casual or not organized, right? So that's some of the complaints about foster care homes. Again, like I said, with the adult residential care homes, those and these are like, they get a bad rap a lot of times. But the key difference between the 2 residential ones is that foster homes are required to accept people who rely on Medicaid. And so what a nice thing. The other thing about foster care homes is that, the conditions may be basic. You're living with that family, and whatever, lifestyle they have, sometimes they might seem a little bit messy. Sometimes they have kids running around. Again, that could be good, that could be bad. But the same kind of, constant service 24/7. The other thing about foster homes is because they're nursing level residents, like it's hard to really connect sometimes with these other residents. They may be a little bit more like comatose or not able to communicate. And so sometimes people feel very kind of isolated in a foster home. Ooh, okay. 4 more, sorry, promise. We're not going to go into these next 2 too much because there's few options for them. But intermediate nursing care is when somebody needs a lot more assistance in some sort of medical or nursing need. So there's people who maybe have like tube feeding, maybe I'm on oxygen use, or have like some kind of certain types of catheters. These are services that are a little bit more nursing in nature and not just your ADLs, right? So for people with those sorts of needs, an intermediate care facility, which is often called long-term care, is going to be a large space and going to feel a little bit clinical. It's going to be perfect for those people that need the nursing care, and maybe that's not constant, but they at least need nurses and maybe even physicians around to address issues that come up. The downsides is it feels like you're living in a hospital, kind of. These are, you're talking 8-foot hallways, shared bedrooms. Sometimes people are in the hallway just sitting there. You don't know what they're doing. And I'm sure some of you have had experiences, visiting people in a nursing facility. And so it's a different feel, right? It can feel very institutional. And oftentimes the residents, intermediate care facility patient resident is mixed in with the skilled nursing patient mix. And so we'll talk about that. It just feels like I'm sort of in a hospital or some sort of like institution. But there's nurses, RN nurses, there are physicians. And so if I need those extra kind of more medical services, then I can receive it without, having to bring in a nurse into my home or something like that. They provide meals, medications, maintenance of my room, although my room might be shared with 1 or 2 other people. And then added fees could be like if I live with dementia in the nursing facility, they don't have the staff to accompany with me. And so sometimes people have to hire companions because I might be wandering around the facility and going into other people's rooms and whatnot. So the facility might say, you need to hire a companion for your dad so that he's not disrupting the rest of our services. But intermediate care and skilled nursing facilities are often, like I mentioned, in the same place. So Halenani, Manalani, Avalon, right? These big sort of nursing facilities are serving a very important need, and they're sort of a niche. Now, skilled nursing is kind of often called rehab, or it's often kind of called a nursing home, which is different from care home, right? And that is going to be nursing services that are temporary. I had a stroke. I broke something. I had a fracture. I did something and I went to the hospital. I was at the hospital for a little while and then they discharged me, but they said, you can't go home yet. You need to have rehab or you need a little bit of extra care, but not the acute sort of hospital level. So a lot of times people who move to nursing facilities come from the hospitals and they receive maybe 30 days, 60 days, 90 days of rehab services, physical therapy, maybe speech occupational therapy, and it's temporary. Now, the nice thing about skilled nursing is that it's covered by health insurance, which is really like a big thing because it's costly. But it's always going to be like a setting where somebody is just kind of there, they pass through and then they go to the next setting, like back home, where they go to, they may even stay, but they switch over to intermediate and not skilled. And once I switch to intermediate, that's all private pay versus skilled nursing, which is paid for by health insurance. But it's again this like institutional environment, like I'm living in a hospital, and a lot of times people who go to these facilities may address the temporary need that they had for therapy, but maybe something else comes up because of lack of stimulation. Or for people that live with dementia, if they go to the skilled nursing facility, sometimes their dementia worsens because it's this new environment. And so it can be really challenging for them to adjust. And a lot of nursing facilities are under pressure. This service is paid for by health insurance and the government, like Medicare. And so they are under pressure to cycle people out because after 30 days or after 90 days or after whenever their medical director says, this person is no longer making any improvements, then insurance is done. They stop paying. And so a lot of times families feel like, well, gosh, you're discharging dad, but like he can't go home yet or he can't walk yet, but insurance is no longer going to cover it because they say, yes, he can no longer walk, but he's not making any progress. And so that's the challenge that a lot of families face when they're getting discharged or in a skilled nursing facility, is that it comes down to insurance. Now, some of them may say, you can stay, but we're going to switch you over to intermediate and you got to pay privately. Other facilities aren't even open to that, especially if that resident is wandering or causing a disruption. So sometimes it feels like people are getting kicked out because insurance is stopping. And so it's very important for families to be like kind of an advocate. And like if your loved one is in the nursing facility, they have these health conferences where they'll say, okay, dad is kind of having PT and he's progressing, but we're going to start to look at discharge. If you feel like, well, wait a minute, his insurance is going to cover up to 120 days of this service, you can, ask them to reconsider or try to say, let me talk to dad and get him to do the exercises. Because if dad is at the nursing facility and he doesn't want to do the PT, he says, I don't need this, then they're going to kick him out. But if he's there and I say, okay, look, it's either there or you're going to come back home with me, then he may be a little bit more inclined to do the PT and do the work there, right? So people feel kind of kicked out a lot of times in these facilities because insurance, and to be fair, they're under the gun to make sure that they're not stuck with anybody who is not going to pay privately, right? Okay. And like the other intermediate, like, they provide everything you need there from day to day, but they won't provide a lot of attention, like from a caregiver. You're not going to have a caregiver there to kind of feed you, or maybe there will be that, but there's not going to be a caregiver to kind of help you walk around the premises and enjoy your time there. So anyone who needs accompaniment and companionship, they usually have an extra fee. Okay, last two, and then we'll be done with that. Two other types of services. Something called life care and then hospice, which we'll talk about. You may not have heard of life care facilities, but life care facilities, we have, I think, 3 examples in Hawaii. Arcadia, 15 Craigside, and Kahala Nui. Now, one Kalakaua is a little different because, well, it's a little different, but all 4 of those places require you to make some kind of deposit. And the first 3 will say, okay, your deposit may be, like a lot, like, $1 million or $1.5 million. But if you run out of assets beyond that, then you can use that money to cover your care. And then when that person passes or moves out, then in theory, that whatever's left goes to their estate. Some places have like a set, like, okay, we return 90% to your estate. Others will, if you don't use it. But life care facilities are usually these big places, right? And we only have 3 in Hawaii. And that's very different. I mean, the type of service is very similar to like the Plaza or a Hawaii Kai Retirement, Ilima at Lehano, these big campuses of continuing care. So they may have independent, assisted, skilled nursing, and you can stay all on one campus under their service. That's called a continuing care retirement community. But within continuing care retirement communities, you have these life care facilities where they say it's a financial thing. You deposit all this money to us, and then we'll give it back to your estate when you pass. Now, Kahala Nui has like a 3 or 4 year wait list. They're very popular. They're really nice places. It's like living in a hotel, and you have all these meals and all this stuff. But it's hard to get into them, and it's costly, right? The other issue or downside about that is, like, I might not stay there for so long or want to stay there through end of life because maybe they're going to charge me for services that they don't provide. A companion to walk me around. Again, like being independent or assisted, like I have my own apartment, but they're not going to come in all the time and help me. So then that's an added fee, right? And I have had residents at my current home that came from some of those, and they've gotten into some disputes about how much money they get back from the life care facilities. So, it's very specific. But it can be a nice thing to sort of feel guaranteed that once I'm there, like they can take care of me, through end of life. It's just maybe it's going to cost even more than the down payment. Because on top of that down payment, there's still a monthly fee for all the meals and all that good stuff that you're getting. And then the last thing I'm going to talk about is hospice. Now, we're probably all familiar with the idea of hospice. It's serving people when they are getting towards end of life, right? That's what it's for. The thing you might not know about hospice, one is covered by health insurance, and two, the doctor can make a referral to the hospice organization, and then they will anticipate that you have maybe up to 6 months left. We always assume, or I always associate hospice with just that last moment. I'm on my deathbed. But actually, hospice services are, can be provided up to 6 months in advance of this estimated death. Now, it's not an exact science, right? So if I live beyond 6 months, they can add on more time or another 6 months, and I get recertified. Some people, like in my care home, I just had somebody who has been on hospice for like 2 years. And finally, the doctor was like, okay, look, you're not going. Now you're no longer on our program. Oh, well, see, no. She's still with me, but the hospice program is extra. So hospice can happen anywhere. If you're living at home, if you're in a care facility, if you're in the hospital, they have these programs. There's like 4 big ones: Island Hospice, Navian, Bristol, St. Francis. They can go to wherever the senior is or whomever is, getting towards end of life. And it's a really great service. I mean, like, talk about heavy, a lot of emotions, but they provide supplies, like Depends or incontinence supplies. They'll provide supplements, all the medications. All of that's covered by hospice, whereas most of the time in the facilities, that's like an extra fee. They also provide spiritual services, like, are you a Buddhist or a Christian or whatever? And they'll have people come and work with you. They do grief counseling in advance. So a lot of times, again, we think, oh, I got to call the hospice because dad is like at the end, but it could have started much earlier. And that's one of the beautiful things about it, I think. It's, and you're getting all this free stuff. Well, it's not free, but it's health insurance covering it. The downside is, of course, like, we don't like to talk about death a lot of times. And we don't want to accept that sometimes, that, my sister or even myself am getting closer to that point, right? So that's one of the reasons why we associate hospice with the very end, because I don't want to think about it to the very end. The other issue with hospice is that if, I'm enrolled in hospice, but then I have some health issue that the doctor says, oh gosh, you need treatment for, it's not going to be covered by health insurance sometimes, because the idea is I'm getting towards end of life. So why would they try to address some new health intervention that is going to try to prolong my life, or that is going to be, addressing? Now, if I get sick, or if I have an infection or pneumonia or something, I can still go to the hospital and get service. But it's more of these like kind of interventions for, let's say, cancer treatment, or interventions for, something that we know is going to be an issue if I don't address it, right? That's one of the downsides to being enrolled in a hospice program. However, in recent years, hospice programs have all developed this other thing called supportive care or palliative care, which is different from hospice, but it's the same organizations that offer it. And supportive or palliative care could be like, I just live with chronic pain, or I have some health condition that I'm really challenged by, but I'm not like at end of life. And so palliative care or supportive care is also covered by health insurance, but that service is the same for hospice. And the key part of hospice services is it's not like I can go there and they're going to take full care of me. There's maybe 2 hospice facilities in town, but they're not very large. Otherwise, if I'm getting hospice at home, then a caregiver will come twice a week to give me a shower. The nurse comes once a week to kind of assess me. But all the other hours of the day, if I need help with ambulating or bathing or all that stuff, I'm going to need somebody to provide that service to me, right? So hospice is really great, but it can be an unpleasant topic. And there are some kind of key strategy things. I mean, like if we know that I'm going to be at end of life, then by all means, I want to enroll. But if I have some sort of, condition that maybe it's gray area, I may not want to enroll in hospice till it's kind of more clear. Okay, well, I am very, very impressed by everyone for getting through all that. And now we're going to kind of be a little bit more interactive, but also like, not so reading from a paper here. I have some comparisons that may be helpful for you to kind of understand the differences between these. They are color coded. Home care is anything kind of home-based or day-based is green. You have independent assisted living is blue. The residential spaces are this kind of brownish or purple color, and then the sort of nursing ones are red. Now, one important distinction is this custodial versus nursing care. Custodial is like kind of insurance speak. It's help with those ADLs, assistance with daily activities of daily living. And so if I need, help going to the shower, if I need help using the bathroom, somebody that's doing that doesn't need to be a nurse. They could be a caregiver. They could be my son or daughter. And so custodial care, these services sort of fit into that. Once I need, actually an RN looking after me or some of these things, then you get into these types of care as well, or with oversight. And this has a lot to do with insurance payment, which we'll talk about actually shortly. So that's one distinction, is like, do you need just ADL assistance or do you need like kind of nursing care? That's the distinction there. Now, the way that it's paid for varies depending on my needs. So there's private pay, cash out of pocket. There's some sort of subsidy, and that could be either health insurance. There's also some public assistance, and there's also like certain grants that Elderly Affairs, for instance, they have. And so these are generally just all private pay. Now, some home care actually is a little bit in the both, where there may be some assistance for payment for that. But generally speaking, if I'm at the plaza, if I am in a care home, usually I'm required to pay out of pocket. If I have a home care agency, sometimes that's also out of pocket. Subsidized care like home health, day health, that's going to be, home health is covered by health insurance. Day health, iffy. Day health is maybe covered by like the city has some grant money to help families with that. Skilled nursing, this is that rehab that I talked about. That's covered by insurance. Home care and daycare can, again, the subsidies from the city or the federal government, for different states have a little bit of assistance there. And then these categories of places, have a little bit of both. Now, as I mentioned, foster homes are required to take 2 people with Medicaid, but then that third one is paying out of pocket, kind of always guaranteed. And they're kind of subsidizing the care of the other 2, because Medicaid, for a caregiver, if you are or aren't aware, Medicaid oftentimes will pay out like $1,400 a month or something to take care of a person. That's not a lot of money to take care of a whole human being, feed them, give them, a bath every day, that kind of stuff, right? And so those 2 people on Medicaid, their care is often being covered by the person that's getting a private pay, which may be, charging like $5,000, $6,000, $7,000 a month. Most adult residential care homes called Arches do not accept Medicaid, but there are some, especially the older ones, that will. And then intermediate nursing facilities also have some beds set aside for Medicaid. But that's the payment structure. I mean, for the most part, like a lot of long-term care is just out of pocket, which is one of the stressful things about it. Last comparison here is the setting. Some of them are residential, some of them are kind of a group living setting, and then some of them are very clinical or even institutional, right? So the home type places are all here, whereas these may be like bigger. Most adult daycare programs may have like 40 participants, and there's a lot of people there. Independent assisted living facilities are generally always kind of larger. and then these larger care homes as opposed to the smaller ones. Again, if I'm living in a nursing facility, I feel like I live in the hospital. And so they're different in feel, which is important. I'm not going to go through each one of these. You actually have this table on your handout. And for the people on Zoom, there's something you can download. But this has really a lot of details about the differences between these types of services. And one of the ones you might be most interested in is like the very bottom, how many actual beds or spaces there are for these on Oahu only. Now, let's talk about costs here. So this starts at $2,000 a month and goes up to $14,000 a month. The green ones are kind of home-based, as I mentioned. The blue ones are independent assisted living. You have foster homes, you have care homes, and then you have nursing facilities, right? This is very intimidating looking, and it's very, very crazy to look at when you compare the costs. But just remember that you may not actually need this till much later. And especially this is actually, skilled nursing care, again, is covered by health insurance. So at least this would be an out of the pocket. These are monthly rates. And if I need day services, like I'm going to have home care, or sorry, daycare, that might be like $80 a day. And so if I'm going 5 days a week, then my day care services will be about that much. That sounds much more reasonable than if I'm going to live in a place 24 or like an assisted living facility where they charge, up to maybe $7,000 for my private apartment, my 1-bedroom apartment. Assisted living facilities charge even more per month. And this is assisted living if I have the companion come and like service me in my assisted living facility. Oftentimes, home care or these companion rates may be like $25 to $35 an hour. So one of the biggest points I like to make here is that with home care, if I have 1 to 4 hours a day of home care, I may be paying about $2,000 to $4,000 a month at $25 to $35 an hour. But once I go up to 4 to 8 hours a day, or even 8 to 12 hours a day, then that's a lot of money for 12 hours a day. Whereas if I'm in a foster home or a care home, I'm receiving 24-hour a day service. Plus, these will cover my meals, some housekeeping, these things that I would be paying for out of pocket at home. So one of the key points about this is depending on how much time is needed for hourly services, like the cost is so exponential. If I were to get 24 hours a day of $25 an hour, that's already going to be like, $15,000 a month just to stay at home. So maybe you start to have that conversation with dad. Okay, look, you said that you wanted to stay at home, but look at this. I mean, you're up 3 times a night, and I don't want to take you to the toilet 3 times a night to save on this money. Let's start looking at other facilities, right? And so the level of assistance as you get closer to where I'm standing, it gets higher and higher. Type 1 care homes, the small ones may range between, at the very least, I've seen around $3,000 a month, but they go all the way up, and the bigger facilities as well. And this excludes additional fees. Some places have fees for this or that. So it's very important as you look at the costs and how you strategize, which I've talked about in other seminars, how you strategize the timing of all this. Because moving into Kahala Nui now, when I'm like, 75 and healthy, sounds great. But if I, have my parents live to like 100 years old, then I might need to look at paying for care for another 25 years or something, right? So you have to really factor this in. And I know everyone really does think about this a lot. There's options for when I have a lot higher care needs, and this is on your sheet, I believe. Actually, no, it's not. So if I need memory care, like assisted living facilities oftentimes have a special floor for memory care or dementia services. Or I could go to a care home that provides something called expanded care, which is nursing, intermediate care level. Or I could go to the foster home. And so these are similar in the residential space. And then lastly, if I really, really need nursing services, then I'm oftentimes living long-term in a nursing facility. Mauna Lani, a nursing home up on the top of St. Louis Heights is one of those examples where people live there long-term. So that's where I would go if I need a lot of help. And then I'm going to really breeze through one of these recommended things that I have when it comes to how to actually evaluate this. I have a whole nother seminar that we talked about the top 5 tips to figuring out the best fit. But when I'm actually evaluating a care option and typically facilities, these are 4 steps and they're in sequence. So what do I need? What kind of care do I need? Maybe I just need some assistance as I have my high risk activities, showers, toileting, but maybe I need help with even just getting out of the chair and stuff. And so looking at what kind of services they provide, you want to ask yourself, are they going to even address my needs? You know, if I have a need for accompaniment, but I'm going to the daycare and they don't have the caregiver for that or assisted living, then that may not meet my needs already. And that's like an option that's not appropriate. But it's important to look at not just now, in the future, what is my need going to be later on? And a lot of times, unfortunately, I've seen people who get pigeonholed when they live with dementia, especially, and they have behaviors, they're disruptive. And it's no fault of their own, it's the disease. But if they move to a new environment, if my grandmother who lived in her home for like 60 years, if she had dementia and she moved out of that space, like she would be confused, no doubt. And she would maybe get agitated or aggressive with the caregivers and other residents. And so a lot of times people actually get pigeonholed because they move to a place and then the place says, well, you know what, I'm sorry, we can't take you anymore. So they move grandma out maybe a few weeks later. Now she's more confused because she thought she was there, but then she thought she was at home. Now she's in a third place. And I've had families come to me in the past and say, look, my dad's been through like 4 different facilities. None of them want to take him anymore because he's got this confusion and agitation. And sometimes the only option that they're presented with is to move to the nursing facility. And that's not really a nice environment for dad. So it's important to, again, look at what is that place going to provide, what kind of service, and is that actually going to meet dad's needs for his cognition and being in a quiet environment. I really highly suggest that you can watch my presentation that's recorded about the top 5 tips for the best fit. That was the first presentation in this series. And the level of care is determined by the doctor. The second one always, if I know that this place can actually provide my needs, is how much is it going to cost? Like, just can I afford that? Because my needs at this present time, I'm 42 years old, are very low. If I went to Kahala Nui, I know that they're going to meet my needs. I'm going to go to the dining room every afternoon and get, you know, this and that. I'm going to have all these activities. They're going to go on outings. So I know that Kahala Nui can meet my needs. But do I have enough assets? Can I afford it for the next, you know, 30, 40, 50 years in my current age? And so it's important to maintain that adequate funding, because as we need more care, as you saw on the graph, it gets more expensive. So you don't want to be short-sighted and say, okay, well, they're going to meet my needs now. Presentation number 3 that we did was about care priorities. And I talked about the care period, you know, how long do I need this care before something in my life is going to change? So you want to look at this care period and future care periods. If you can anticipate it, how much is it going to cost and can we afford this over the years? Because it may lead to having to make some tough decisions and saying, well, instead of going to the assisted living facility, maybe I got to go to a small care home or something that's going to be much less. You want to budget out the future. And then once I know that the facility can provide what I need, I can pay for it over the time that I need it for, then you start thinking about all the nice stuff, the bells and whistles. Like, am I going to have a private bedroom? Do they have air conditioning? Is it in the neighborhood I want? Like, these are questions that we typically think of first. But it's step 3 in my book that, like, we need to know that they can provide the care. I need to know I can pay for it. And then I'll start thinking about like the amenities. Ooh, they have free coffee. Except I got to pay, much more every month for that free coffee. And then, again, like step 2, presentation 2, we talked a lot about family involvement. Some places are welcoming your helicopter children with open arms, and other places say, what did I say? There's a no-fly zone in our facility. So, these are very important questions, but it's step 3. And then lastly, then you look at value. And my last presentation we did in June was about this. What are my priorities? Because everyone has different priorities. And so how is that facility going to really provide me the best value, which is subjective, right? What you want is different from what I want. And we may be 2 siblings trying to decide the care for dad. So really looking at balancing those priorities and sorting out the needs and wants. Here's some examples that I talked about in previous seminars. The staff qualifications versus the staff ratio, the physical and cognitive abilities mixed in with the size of the setting. That's like a big, big one. How much is it going to cost for me to not feel guilty about sticking mom in this place, and the environment of how it looks and feels. The Kahala Nui thing I just mentioned, it's got a nice environment, but it's not really meeting, and it's meeting my care needs now and in the future, but it's not in my budget. So these are some very common priorities that we look at. Do I need to wait for an opening, or should I just take whatever is available now? Who is coordinating my care? Are they different from the person that's actually paying for my care? Because that can set up some conflict. And these are very common priorities. Oh, okay. So how do we actually just use everything I just told you? Okay. Well, I'm very impressed that you're all still in this room, seated in your seats, because that was a lot of information, and I don't expect any of you to remember all of it. I don't want you to remember all of it because you don't need to. The key is to actually use it at the right time, right? And so putting this information to use is really about how do you narrow down all of that I just said based on the right fit of what you're looking for, maybe now and for later. And so I have on my website everything I just said and in written form. But I wanted to really emphasize one thing, which is on my website, I created this quiz. It's a quiz that is totally anonymous. It doesn't collect, any information about you personally or anything like that. It's all multiple choice questions. And there's about 8 of them at most. Now, depending on all those things I just went through, the upsides, the downsides, who it's for, that kind of thing, you can take this quiz over and over again. And when you change your answers, it will spit out potentially about 30 some different possibilities of what is most appropriate for what you're looking for. So you could do it for yourself. You could do it for mom or dad or your spouse. And based on these things I mentioned about care, especially how much care around the clock, your budget, and then thirdly, some of the stuff, a little bit of the stuff about your personal preferences for the size of the facility, it spits out some options for you that you can then say, okay, we went through that whole exercise of looking at every single one of those 9 different types of services, but I really just need one type at this stage, right? And so it's a real quick and easy way to narrow down, do I need a care home or a nursing home or a foster home or assisted living or home care, daycare, right? Based on those 3 things. So this is on my website, and I'm going to show you the page later, but like it's something I developed with a computer programmer is nuts kind of doing that, but it's a very quick and easy way for you to narrow down what you're looking for in terms of a category. And then once you know that category, then you can go on the website and you can look at a section that has basically everything we just went through, you can read about daycare again, or you can read about home care again. And this is information that I've gathered from different entities, also from running a care home myself for over 10 years. And you can actually reference all of that information on my website, kupunacarepair.com. It's a lot of information. So if you sat through this, great job, kudos. You can also just revisit it on the website. And there's also a map of every single licensed facility and service in the state. You can go in, you can zoom in, you can click on it, you can look at their phone numbers, you can see what kind of facility it is based on the color. And isn't that really crazy? Well, it is crazy to think, do I really want to go through all of that map? This is a picture of Waipahu. Oh gosh, sorry. This is Waipahu with care homes and foster homes. So it's very overwhelming to think, well, gosh, there's 1,800 plus long-term care facilities and services in our state. But, oh yeah, okay. So I just heard 1,053 foster care homes on Oahu. It's true. I just looked at that, state listing, 423 care homes on Oahu. And so how do you choose one, right? Well, you only need one, so that's a good thing. But there's a lot of capacity in each one. This is the homes, and each one has like 3 beds and 5 beds typically, right? Assisted living facilities might be like 80 to 120 people. So it's great that we have this supply. It's actually not enough. It's great we have it, but it's like, how do I pick and choose? Which umbrella am I going to sit under here, or move my mom to that facility? And so I've developed something also on my website that I call the Elderly Care Marketplace. Anybody ever booked a hotel online? Yeah. I go to Expedia or I go to some place and I can search by, well, like hotels in Waikiki. And I can search for a 1-bedroom suite. And I can search for all these things. So basically, I created this marketplace that at present has about 160 different residential homes, but I'm looking to expand that into daycare and home care agencies and all kinds of other stuff. But you can go on there, you can look at photos, you can get a feel for the caregiver and the person who operates that. And the whole goal is to not go, throw net fishing, but spear fishing. Then the distinction is when you look at this map of like all the services, in the state, and I just pick up the phone, I'm just going to whoever is out there that sounds good. But the idea on my marketplace is to say, only call the places that are going to be useful to you. So there's about 100 criteria that you can search by. Private, do they have a private bedroom? Do they have AC? Will they allow my pets? Do they have a fire alarm? What is the COVID vaccine requirement? What's the staff ratio like for caregivers compared to patients or residents? There's a lot of criteria. And so of 150 plus care homes, if I filter by ones that have private beds, oh, great. Now I only have to call 92 of them. And then I want a private bathroom. So now I only have to call 28 of them. And oh, by the way, do they have an opening now? Yes, there's 12 of them. And then they're going to charge less than $6,000 a month. Now I've gone from calling everybody on the marketplace to just 5. And I don't even have to think about the other ones because I already know if I'm looking for a private bed and private bath and vacancy now, then like they're going to tell me no, they don't have that. So that's the concept. In reality, I have only like about 10% of what's available in our whole state on the website, but it is growing and it is being used now. So there are families that send messages to the caregivers. They read the profile and they say, hey, that looks like a nice home. Let me get in touch with them, right? And so there's this button here that says contact this provider, and you click that and then you send them a message. You can also copy and paste the same message over and over again to multiple caregivers. And that way you save time because picking up the phone takes a long number of minutes to have the same conversation over and over again. And so, This person had sent a message out to Maritas to say, hey, do you take Alzheimer's residents? Can we have a tour? So this process is not the end all be all. It's just a way to make it a little bit faster so you don't have to go to each place. You still have to get off the website, go there in person, tour it, find out that they have dogs or whatever it is, and like say, okay, no, thank you. But at least you're saving time on things that you know are non-negotiables, and vice versa. The website is also being used by families who need to look for care, but they don't know where to start. They don't know where to look. So this person is looking for safety and comfort for her husband with Alzheimer's. He's in very good physical condition, but his cognition is not very good. He needs help with showering, shaving, sometimes getting dressed. He needs long-term care. He's at home right now with several private caregivers. We can pay out of pocket. Here's our monthly budget. None of that is personally identifying. Doesn't say here, this is my husband's name. But the caregivers will see this listing and then they say, oh, well, this sounds like somebody I could take care of. So then they reach out and contact and they say, come for a tour. I've got an opening. Why don't you see it? And this person in particular was a very notable case because she was looking for a place for her husband, but she only wanted to be in town. Oh, I don't want to go past the airport. It's too far for me. But she couldn't find anything within her budget because a lot of places in town might be more expensive. So what she did is she did this listing, and lo and behold, one of the caregivers reached out and said, look, I'm in Eva Beach. Come for a tour. And she responded saying, oh, I'm sorry, like Eva Beach is too far for me. But the caregiver was able to kind of, say, well, give it a shot. If you're not able to find something in town, try it out. And so eventually she did have to go for a tour, and she fell in love. She really, really connected with his caregiver. The home was great for her husband with Alzheimer's, and she moved him in. And she would have never found that place in Eva Beach or decided to even go there without being first contacted by that caregiver. So it's, again, there's a lot that happens in between this and moving in, but at least it's a way for you to save time. So it's something I've developed on my website, and I wanted to kind of show that to you, but also before I do any of that, I'm gonna finish now. And then if you want to stay and talk more or see more, that's great. Especially for the people on Zoom, if you want this little cheat sheet that I left for all of you, you can fill out this evaluation form, and it will give you a link to download the cheat sheet. All of you have the cheat sheet, but I do still request if you can fill out the eval form so I can send it to Elderly Affairs and say, somebody actually showed up. The last seminar that I have in this series for this year is on August 26th. It's specifically about home care or care at home. A really great topic, especially about strategizing. Okay, when is it the right time to think about moving out of home? What are some of the pro tips to make that successful and to extend my time at home? So that's August 26th in the same room. And then other seminars that I have coming up, pitfalls to avoid when working with caregivers. There's a lot of emotion involved when you have your son or daughter taking care of you or a professional caregiver. Managing the cost, we'll go into strategies about, timing and how to avoid paying higher costs now versus later. Fitting in with the cool kupuna is about, how do we make sure that we feel engaged and meaning to, how do our seniors feel engaged if they're living together with other seniors or in a facility and that kind of thing. But these are yet to come. I think probably in 2024, I'll have these. And I just want to thank you for joining me. I was telling my cameraman here that this is like one of the heaviest presentations we have. And so I'm so grateful that everyone is awake and has made it through all that content. But again, like I said, you don't have to remember it. It's on my website.